What orthotics are best for treating plantar fasciitis and heel pain is a question we're often asked in the clinic, and it's a great question because plantar fasciitis is possibly one of the most common pains we treat in the clinic. And so treatment for plantar fasciitis is usually aimed at what's causing the problem. And that sounds very simple, but it can be a little bit more difficult to diagnose or find out what is actually causing the plantar fasciitis. So just briefly, plantar fasciitis is when we get inflammation in the ligament. So this is the left foot and this is the inside that runs from the heel to the toe. And when the arch flattens out or the foot rolls in, this ligament gets strained. And when we do that every day, 10,000 steps a day, eventually this ligament starts to break down and get little micro tears in it, and then it becomes inflamed. So when we're treating plantar fasciitis, there's a few things we need to look at. Things that will cause plantar fasciitis is anything that can cause the arch to collapse. So if we've got tight calf muscles, a flexible flat foot, shoes that let our feet roll in too much, shoes that are too worn, shoes that are the wrong fit, that are too narrow for our foot and let our foot spill out the inside. These are all things that can contribute to plantar fasciitis. So if we go about systematically treating those by, if you've got a foot that rolls in too far, we put you in a good shoe and support the arch, this will help to treat the plantar fasciitis. So the orthotics that are best to treat plantar fasciitis are usually a full-length arch supportive insole, like we've got one here that we often use in the clinic. So a full-length soft insert like this one, and you can see it's got this long, high medial arch support. And what that does, it helps to pack up the arch and stop that arch from collapsing, and it helps to take the tension off of the plantar fascia, to rest the plantar fascia. And then what happens is once it's rested, the body can go and heal it. So that's the first thing we do. And the other thing we look for in an orthotic to treat plantar fasciitis is, can we make the foot more comfortable while it's healing? And we usually do a full-length soft insert like this one here, because generally where the plantar fascia attaches into the heel, so if it attaches right down into this little tubercle on the heel here, you can see this little thing sticks out right here, that usually gets quite painful because there's a lot of traction in that area in the heel. So what we do is we use an orthotic with this cushioned poron section and a really quite thick, so where it ramps up through the arch, it's really quite thick and soft. So this does two things. It helps to cushion the impact of the heel as it hits the ground and makes the heel a lot more comfortable. The other thing we look for is we've got this nice deep heel cup, and what this does, it helps to keep the foot's natural fatty pad beneath the heel, and then it further cushions where the plantar fascia attaches into the heel. Other things that help on this orthotic to make it nice and comfortable, it's got forefoot cushioning positions to just make the foot feel nice and comfortable when you're recovering from your plantar fasciitis. The problem we usually have with plantar fasciitis and heel pain and treating it with a full-length orthotic is this won't fit into every shoe. So generally what we say is use the biggest orthotic and the most controlling, the most cushioned orthotic you can fit into your shoe, and then you'll relieve your heel pain better, more quickly. So a shoe that can accommodate this sort of orthotic will usually be more supportive. So we'd usually use something like a Brooks sneaker or something similar, and then we'd find, because this can accommodate our orthotic, that's a nice thick cushioned and full length orthotic with a nice high arch support, this will help you to recover from plantar fasciitis much more quickly. We also need to address all the other problems that can cause plantar fasciitis, not just the insole and the shoe. So we need to address your tight calf muscles. If you've got weak calf muscles, we need to stretch and strengthen those. And if you've got any other sort of problems that are mechanical, maybe you've had an inversion ankle sprain, that you've got a really stiff ankle and it doesn't function properly, we need to address this as well. I hope this has been helpful to you. If you've found any of this information helpful or interesting, can you please like and share it, and please send your questions through. Thanks.